Hello and welcome everyone. I'm Kerry Facer, one of the founding partners of Warren Street Wealth Advisors, and I want to thank you all for taking time out of our busy days to sit in and listen on Medicare. And we have an exciting interview to share with you. We actually went back in March, on March 2nd, 2020. I was introduced to Jeff White and Cass Powers, two local Medicare experts. And we actually were introduced to here. If everybody can see this okay, I'm just going to wait for a moment to get a green light here. But Emily Balmages, one of our certified financial planners on the left there, third from the left, she introduced us to two local experts because we had been getting questions about Medicare for so long that we finally realized that we needed some experts. So we actually reached out to Jeff and Cass, and we had an interview right before the world shut down. It was March 2nd, 2020. And so today I wanted you to all get a chance to listen into that interview that we had back then, because Medicare open enrollment is just around the corner, October 15th. But the one thing I want you to all understand is this. You must enroll in Medicare when you turn 65. Please do not forget this. There's the interview to come here is about 22 minutes, I believe. But that is the one thing I want you to understand, because if you don't enroll in Medicare at age 65, you can pay a penalty for the rest of your life. There are some exceptions to this if you're still working. Jeff and Cass cover that during this interview. But that's why I am so excited to have them in our lives as trusted partners of Warren Street Wealth Advisors. So without any further ado, let's take a look at the interview. Of course, before we do, a fun little icebreaker. Data, no, I just trust my gut. And she says, well, that explains the ulcer. So let me pull this up. Please note, we are live. I am going to be hanging around here watching this interview again with you. So if you have questions along the way, please use the chat or question feature. And at the end, I will do my best to answer any questions you have. If I am unable to answer those questions, I am going to put you in touch with Jeff and Cass. So please enjoy. Well, welcome everybody to I'm Almost 65, so now what? Thank you for joining me. I'm Kerry Facer with Warren Street Wealth Advisors, a founding partner and wealth advisor here. And today I have with me Jeff White, a Medicare specialist at AGA, and his sister, Cassandra Powers, a Medicare specialist at AGA. Are you two there?
Yes, we are.
Good, good. Well, welcome. Hey, why don't you two just take a quick minute, introduce yourselves. Let everybody know who's listening in, who you two are.
Yeah, so I'm Jeff White. I'm going to be 49 years old pretty quick here next month.
Happy birthday.
And I got, thanks. So got into insurance probably almost 20 years ago, but Medicare specific right at 14 and a half years now. And my sister Cassandra, she can introduce herself and then say why we got into this, because it's kind of an interesting story, and it makes sense for a lot of the folks that are going to be turning 65.
It sure does. So I'm Cassandra Powers. I will not say how old I am, but I am much younger than Jeff. Actually, I was in another branch of insurance, and after Jeff got into Medicare just for a year or so, he said, you know what, I really need you to help me. There's a huge need for people to get just accurate information and not such a sales pitch. So ironically, it was around the time that our father was making his decisions about Medicare. So we couldn't figure out why every time he called somebody just to ask a question, there was, you know, this real solid sales pitch. He just wanted to know how the moving parts of Medicare worked. So we kind of capitalized on that and just thought, you know what, people just need good, solid answers. They'll make a great decision once they understand what's going on.
Yeah.
And every time he would call Social Security, he would get a different answer. And we were just, how can that be? But that was the situation. So there was a need, and we figured, hey, it was time to, you know, and it's what we do is nice because we don't charge anything for our services because we're compensated by the companies. And at the end of the day, we're just helping people that have to do something, but they're overwhelmed with the misinformation and so many choices. So it's fulfilling to be able to just help people.
Yeah, we love it.
Good. Well, we're so excited to have you with us today. And I have some questions, so I'm going to throw them at you, and we'll go rapid fire here. But I was thinking we could do kind of a 5 essentials everyone should know before enrolling into Medicare. And I also have some other things I want to ask you at the end, so hang with me here. But I was thinking about this. You said so many choices. I was hoping you could take a minute or two, because the last time we spoke, Jeff, you shared something with me I did not know a lot about, and that was the original Medicare versus the Medicare Advantage plans. Can you give us a little bit of history of those two and help us kind of, anybody who's listening, navigate their choices just from a very high level on those two?
Sure. I'll take original Medicare first. So the Medicare program started back in the 60s, and it's come forward where Medicare, basically, if someone elects to have original Medicare A and B, the government is going to cover approximately 80%. There's other cost sharing, there's deductibles, but A, hospital, B, medical, or what a physician would do, then you need a supplement. And so the number of supplements for many years, the best supplement was J. That went away maybe 7 years ago. And then it was A through N. And now it's been streamlined down where there are fewer supplements. And the best supplement you can get now is G if you turn 65, January 1st, 2020 or after. So there's just, if someone does that and goes that route, then they can choose that supplement federally standardized from many different insurance companies, some that go quicker than others, some that are nonprofits. Mm-hmm. And so there's a lot of choice, even if you go with, hey, somebody I know has G or F, I'm going to go with the same supplement. Well, it depends on who you go with as far as how rapidly it's going to increase, because they all go up with age. So that's just one side of it, and I'll let Cass talk about Medicare Advantage.
So, and one thing I want to add is on the Medicare A and B, the Part D is not included in that at all. So that's something that people have to, they'll be penalized if they don't get a Part D. So that's just something that Medicare doesn't. Medicare oversees the Part D plan, but they don't offer a Part D. And many people, there's a little bit of a misconnect on that. They think that Medicare offers one. They don't. They just, manage them. So a Medicare Advantage plan is where you hand over your A and your B to a large company, mm-hmm. An insurance carrier, and this is where it gets a little confusing. They're called Part C Medicare plans. A Medicare Advantage plan is a managed care plan, also known as Part C. So you have A and B of Medicare offered by the government. Mm-hmm. If you want to move to a managed care plan, you would choose a Part C. And in our area, there are well over 40 plans.
Wow.
Okay, so 52 plans for people to choose from. Typically, the Advantage plans are HMOs. I would say 99%. There's like one that's a PPO, but mostly HMOs. They have huge networks. They're great plans for somebody who really wants to keep their costs low.
Okay.
So your Part C takes over your A and your B, and it includes the drug plan. That's kind of why folks like the Advantage plan, if there's kind of a nice little package deal.
It's probably simpler for them to understand and say, okay, package deal. But now I'm just going to ask you, we talked about this earlier. You mentioned something about IRMA and how important it was for us to understand what IRMA is and how to navigate that, or what that even really means. What the heck is IRMA?
So it's IRMAA. What it stands for is Income-Related Monthly Assessment Amount. What the government does is they do a 2-year look back on your tax returns, and they have 6 different tiers. So if you go over a certain amount, whether you're filing individually or jointly, you are, like, the premium for Part B right now is $144.60. If you achieve the first tier or the second tier, it could go up $50 from there. The tier 6 is like $428 or $432 a month for your Part B. So it really steps up. Mm-hmm. It's temporary in that what they do is they do a 2-year look back. So here we are in 2020. Once those taxes are filed for 2019, they'll look at 18 and 19. They're always looking 2 years back. The thing is, if and the reason people run into this is usually around the time of retirement, they may get some sort of, windfall or sell a property or something, so it bumps them up. So you get this assessment where now your Part B is $200 or $300 more per month.
Mm-hmm.
You can call Social Security and tell them, hey, that's not what I'm making currently. Yes, that's what happened last year or the year before. And they will adjust that down for you.
Really?
And it's based on a phone call. And a lot of people don't know that. They just pay it, and then that's lost funds.
We've seen it be removed a lot.
Yeah.
But you have to be proactive. The
Yeah.
government's not going to give you your money back. You have to.
Shocking. Okay, so is that something we work through you on, or do we call direct? I mean, if we have a case or a client we know has that situation and we need to make the phone call, go through you, go direct. What's your recommendation?
Call Social Security.
Just call them
they will
direct.
not speak to us.
Yeah.
But we can give them advice and tell them what to say. I want to appeal this. They might have to fill out a form, but it's definitely they have to speak to the person that is entitled to Medicare.
That's huge. I'm turning 65. I'm your father. Which way are you pointing me?
So it depends. If you, let's say you really want freedom and you want to be able to see doctors in different counties and different medical groups, you're going to want to go Medicare and a supplement, because then your out-of-pocket is going to be minimal and you've got the freedom to go anywhere in the nation for routine care with no need for referrals or authorization. But if you're in Orange County, let's say, and you have several doctors and specialists that are part of St. Jude or Greater Newport, and you like those doctors and you don't have a lot of doctors in different counties, you could go on a $0 per month premium Advantage plan and be able to see all your doctors. The one difference between original Medicare with a supplement, go wherever you want, whenever you want, and an Advantage plan is you'll have to get a referral to go to a specialist. That's the one major difference.
Okay. So let's pretend I'm still working and I'm turning 65. Any differences? Do I still enroll? Do I not enroll? What do I do?
There's a couple little tiny details, but for the most part, most folks do not have to enroll in Medicare. If they're covered under a large group plan, it's adequate coverage. So they have to, when they decide, let's say we have many people that will call us at 70 and say, I'm retiring. I did not take my Medicare when I turned 65. That saved them a ton of money. And they have to go to Social Security and prove that they had adequate insurance for the last 5 years. So once they turn 65, they just have to make sure that they're covered. If it's a small group plan, then they do have to start their Medicare. And we're talking less than 20 employees.
That's right.
So over 20 employees, they do not need to take Medicare. It's a waste of money. Stay on the group plan, unless it's exorbitantly expensive. Then there are folks that say, well, I'm paying $500 a month. I want to get on Medicare. Perfect.
Okay.
And one little note on that.
Yeah, please.
So if someone is working or they're under insurance where their mate is the primary and the mate is working, then that's considered creditable coverage. So they can work as long as they want past 65. As soon as it comes time to get on Medicare, they'll get on Medicare, no penalties. Where people get a little bit messed up is they have retirement insurance, and the person that the group insurance comes through, is no longer working. That's not creditable coverage anymore. They didn't change a thing about their insurance. What changed was the person who the group plan comes through stopped working. Now it's not creditable, and the penalties do kick in after a short time. So that's really important to know what you're doing there.
Yeah, it sounds like it. And then, I want to go back to something you mentioned earlier, the group size, the 20 and the 20. So less than 20 and then 20 or more on a plan. Help our audience really understand what that really means.
So if you are working for a company and they have less than 20 people on their group plan, Medicare is primary. That's mandated by the federal government.
On the plan or 20 employees?
On the plan.
On the plan. Okay, so they might have 50 and for whatever reason 30 are covered or exempt, but the 20 who are on the plan are then that's the number enrolled into the plan.
That's the number.
Okay.
So if it's less than 20, then they have to get on Medicare A and B and continue, if they want to pay the premiums on the group plan. So in that case, a lot of times since they have to get on Medicare A and B, they can do a lot better on a Medicare plan. So that's, you know.
Well, we'll evaluate that.
Yeah.
But what's interesting too is the HR folks don't even know what we just told you. So they might go to HR and say, hey, should I, or do I need to, or don't I? We get calls all the time of folks that don't. They said, my HR person has no clue. So it's better to talk to somebody who knows the rules of Medicare. HR people don't.
Yeah, it's so much, and it's like, okay, I know that thing's out there. It's 65, and I just need to enroll in Medicare. And then now we're hearing from you two is there's so much more to really be thinking about when it comes to enrolling in which plan and all the different options. I can imagine why nobody, I mean, myself included, knows that much about Medicare, which is why we invited you two to come in and help us understand how it works. So the 2020 got that part. We talked too about this, and I think you mentioned something about a late enrollment penalty. What is the late enrollment penalty?
The late enrollment penalty is what it equates to is a 1% per month that you, and actually 10% a year.
Yeah, 10%.
You have to cut that, sorry. 1% per month is for Part D. The late enrollment penalty is 10% per year that you do not have either creditable coverage or Medicare, which nobody really does that. That would be crazy. You know, people usually get on the ball, but it would be 10% per year, and the government is very strict about when you are allowed to enroll in Medicare. So occasionally we come across folks that were in good health, kind of just said, oh, I'll get to it later. Then they find out when they want to enroll in Medicare, you're only allowed to do it January 1st through March 31st. So you have a 3-month window, and it's effective July 1st of that same year. So if you miss your window, the government knows what they're doing, and your penalties just continue to accrue, and you have to pay that penalty for the rest of your life. It never goes away.
It's not a penalty on the time period. So if I didn't enroll for a year and a half, and now I'm 66 and a half, and I'm finally enrolling, I have to carry that penalty forever?
Yes.
Yes.
Wow. That's crazy.
So it's 10%
how can you get it to go away?
No, they do never go away.
No petitions. No, I lost it. I moved. Address change. I mean, something.
They don't care. They do not care.
No,
wow. Yeah. So it's I mean, we should be absolutely sounding the alarms to everybody we know, friends, family, the world, that just get enrolled. And even if you aren't sure if you should be, maybe you are still working, you don't need to enroll, but at least go through the process to make sure you're in good shape.
Right.
Yes.
Yeah.
Wow.
Yeah.
Okay, so that's the late penalty. That's crazy. I thought, and I had thought that it was for the time period you were late, but it stays forever. What an awful thing. Okay, well that's good to know. that's something we need to share. So now we have options. How many different HMO plans are available? How would one person even decide how to pick one? Help me with some of the choices.
So depending on the county, Orange or LA County, there's around 52 plans. That fluctuates a little bit. Some other counties are more in the high 30s, low 40s. The main way you would figure out what plan, and this is what we help folks with because it can get really cumbersome, is figure out what medicines you're taking and then see what plans cover those, because many plans may look the same on the surface, zero copay for primary, zero for specialist, zero for hospitalization, but you can have a vast difference in the copays for the medicines. So see which plans all your doctors accept, make sure they're all in network, and then see how your medicines are going to be covered. That's really one of the best ways to get the right plan.
So please.
I met with a client yesterday, and the wife said, oh, all the HMOs, they're pretty much all the same, aren't they? And I said, at face value, they probably look the same. But we went in to look up her husband. He takes Eliquis, and that's a pretty expensive medication. Not only was it an expensive medication, but looking a little further, his cardiologist and primary doctor only took one plan, and they refused to lose their cardiologist. So, they might look all the same. If you had just said, oh, I want, this plan X, they could have been in really bad shape, paid a ton for the Eliquis, and lost their doctors. That's hard for people to navigate. So they do need a little assistance figuring that out.
If we tell our clients, to prepare before, it's know who your doctors are, know what prescriptions you want. They talk to you, and then you can help navigate them. Are we talking about saving you know, a few dollars a month or 100? I mean, what's the range in cost by getting this right versus, oops, I have to pay more out of pocket for my prescription?
I mean, it could be 50, 60 bucks a month, and it could be 1,000 or 1,500 a month. That's how wide the variance is.
So getting it right is because you have the cost for Medicare, and then it brings me into like my next thought is prescription. So there's how many different prescription plans are out there?
32.
Yeah.
32 in Orange County right now. And that's if you do Medicare with a supplement, or you do a standalone or separate Part D, there's 32. If you go Part C, Medicare Advantage, HMO, all the same thing, then the Part D is bundled, so it's just a part of that plan.
Gotcha. So it's back to our original kind of opening question, was trying to figure out which one to start and then go from there. But again, it just depends on each person.
Yeah.
Wow. Okay. Give us some closing thoughts. What haven't we talked about? What's like the one thing that you want to make sure somebody knows when they're getting ready to enroll in Medicare? Like, give me some, or highlight what you've already talked about. Just give us kind of a couple points here walking away.
I think that it's super important to use a broker. That's my one takeaway for people, because if you go with what's called a captive agent, or let's say just the AARP person, they're only going to sell their plan, and they're going to, show all the great things, but they may not show you the deficiencies of their plan. There's no one size fits all. I've had people say, well, my neighbor has SCAN, and I want that. It's like, well, let's just check your meds, your doctors. Is dental important to you? Is vision important to you? Do you want hearing aids? You really need somebody to be honest and open and unbiased on what each plan offers. So whether they use us or somebody else, my goal is to get people to use a broker so they get the honest, the real skinny. And we represent all the plans in Southern California, so we have there's no vested interest in a specific plan for us at all. That's my takeaway, I think.
I like that. I appreciate that. What about you, Jeff?
Yeah, I would say pretty much the same thing. Just to be very careful, because it's really sad when you get the phone call from someone who got bad information. Now they're coming and saying, I didn't have a Part D for 2 years. I wasn't taking any medications. And now they're saying I have a 24% penalty I'll pay every month for the rest of my life. That can't be right. Well, it is right. It's just good to do your homework and have someone really, even if you've already decided, bounce it off someone like us so that maybe you're right on track. Great. Then you're not making a mistake.
Yeah, yeah. How do we get a hold of you two?
Very easily.
Call Carrie. Do you want our phone numbers and stuff?
Yeah, no, give us your phone number. Tell us how somebody could find you. Yeah, honestly, if you're going to be watching this, they want to reach out to you. How do we get a hold of you?
Cool. So mine's easy. I'm casspowers@gmail. CASS, it's 2 S's, and my phone number is 949-606-5711.
And mine is Jeff_W_White@hotmail.com. 949-289-2542 is the phone number. And we do have a website that has some basic information. It's www.mysupplementmedicare.com. And that's kind of nice to have a few videos, and it reviews a lot of what we talked about as well.
Jeff, I love your tie. You're a great guy, but I want to work with your sister instead. Is there any problem with me referring someone to one or the other?
Not at all. No. Whatever anybody feels the most comfortable with. I mean, this is your health care, right? This is important, and some issues could be sensitive. Just wherever you feel comfortable, that's the best thing to do.
Good. Well, I appreciate you two joining us today. Thank you so much. We'll send this out and share your contact info, and thank you again for coming in.
Thanks for having us.
Yeah, thanks.
All right. Bye, you guys. Well, there you go. That was the end of the interview. I want to thank everybody for joining us. If you do have any questions, we had quite a few questions actually come through that I was answering during the interview. We are going to make this available next week. We'll send this out. If you got an email from us and were invited to this event, you will get a follow-up email with a replay. In the meantime, if you do have any questions and you would like to reach out to us, there's our number. I'll also give you my direct line, 714-876-6284. So the number you see right there, 84. Welcome to give me a call or shoot me a text. We are here to help. We are advisors, we are producers, we're proactive, we have a true ensemble, and we'd love to assist our families and businesses that have chose Warren Street Wealth Advisors, and we take that seriously. We thank you all for joining this, and we hope you learned something. Again, next week or so, look for an email from us with the replay. It'll be easy to watch. Just hit play and enjoy it. Feel free to share it with your friends and family as well. So thank you again for attending, and we will all talk to you soon. Have a good one. Bye.